Thank you, Louise. Good morning, everybody. I am glad to open the FIAM webinar on One Health in Action, Advancing Cross-Sector Collaboration. The objective of this webinar are to highlight the importance of cross-sector collaboration in implementing the One Health approach, with contribution from veterinary, human health, pharmaceutical, environmental, and policy sectors. To showcase the role of boundary organizations like FIAM and the forum today in bridging disciplines and driving multi-sectorial cooperation, and to discuss practical examples, institutional experience, and policy opportunities, including how One Health can shape research, policy, and health system. The format of our webinar today is a panelist presentation, 6 minutes each, 4 speakers. Then it will be the moderate panel discussion for 20 minutes. I will ask questions and we will give the floor to the audience. So please prepare your questions. I am a veterinary medical doctor, a scientist at the French ANSES, French Agency for Food, Environmental and Occupational Health and Safety. I have been coordinating several research European projects, all dealing with animal health, zoonosis, foodborne, in a One Health approach always. I have been president of the French Veterinary Academy and the vice president of the FIAM. I welcome you, the participants, and I thank the 4 speakers. I want to mention that many of the panelists present here are members of the FIAM Forum. The FIAM European Biomedical Policy Forum is an initiative developed by FIAM to foster dialogue between the biomedical community and policymakers. It complements FIAM's missions by bringing together stakeholders from academia, industry, public health bodies, and patient groups in the objective to address major European health and research challenges. Through the forum, FIAM broadens its advisory role and promotes collaboration across sectors. How to introduce the theme of the webinar. This session explores how cross-sectors collaboration across medical, veterinary, environmental, agriculture, and institutional boundaries can strengthen our collective approach to One Health. With the invitation to emphasize the evolving role of boundary organization in facilitating collaboration, to mention the relevance of the quadripartite and the HOLEP expert group, and to invite speakers to reflect not only on institutional policy, but also on real-world collaboration and barriers to implementation. The 4 invited speakers are Nancy Debreen from the Federation of Veterinary of Europe, FVE, Diana Teixeira from Animal Health Europe, Maria Jefstich, representing the European Health Management Association, and Tuomas Eivelo, member of the SAPEA working group. So it's time for us to give the floor to the speakers. I introduce Nancy Debreen. She is a FVE Executive Director, nominated in 2021. She was graduated at the veterinarian school as a veterinarian from the University of Ghent. We are going to talk about the veterinary contribution to pandemic preparedness, transboundary plans, and intersectoral collaboration. So, Nancy, please.
Thank you very much. I will share my presentation. Can you see it? Yes? Okay. Thank you very much. Well, thank you very much for inviting FE, and we're really happy because One Health is really one of our core aspects. We work on core topics. So as already was mentioned by our chairman, I'm the executive director of the Federation of Veterinarians of Europe, And our federation is basically the umbrella organization for veterinarians from 39 European countries. And in total, we represent about 330 veterinarians. So compared to other professions like doctors, we're a small profession. As I'm the first speaker, I thought maybe I start with reminding us the definition of One Health. So this is the definition of the One Health high-level expert panel, saying that One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystem. Because the health of people, domestic and wild animals, plants, and the wider environment is all closely linked and interdependent. And for that reason, it's really necessary to work on across sectors, across disciplines, and across communities. So this is what FE does, and we have a lot of work on One Health, on in the respect of One Health projects also, and antimicrobial resistance. And I will not go into that one this time, but I will show you some of the other work we're doing on One Health. And one of them is pandemic preparedness and also disaster preparedness in general. I don't know on the human side and the environmental side, but on the animal health side, we really see a lot of animal diseases, some diseases we haven't seen for many years, and also some new diseases, such as vector-borne diseases due to climate change. Some of these can become pandemic. So for us, it's really important to be prepared for that. And this preparation we can only do in a One Health way. So we have a position paper on that one, how we can work together in a One Health way. We also, as FE, very much followed the pandemic agreement negotiations and are now and gave input on that one with concrete examples how the sectors can work together, not only in developed countries, but also in developing countries. And we're really now very happy that this has been agreed. We also work together with other organizations to strengthen the environmental pillar because we see that in the whole One Health field, the environmental pillar is still a little bit the smallest part, and we really believe that part should be strengthened further. So we work with organizations on that one, and another example of an activity is webinars on high pathogen avian influenza because that's a disease that really worries us for the pandemic potential it has. So we did several of them. Another example is our work together with other healthcare professionals. We now work with them about 20 years, and we really value and cherish this work together. We do together joint press releases. We also develop infographics together. We did webinars and meetings on joint One Health education. So every time we meet, we see how much we share, how much we can learn from each other. So this collaboration together is really very much beneficial. So I come to my last slide. My main takeaway, like I said, I didn't talk about the many actions we have on IMR because often when I see with policymakers, if you say One Health, they just think about IMR. But One Health is much more than just IMR. IMR is extremely important, but that is much more. So it is crucial also in the field of disaster preparedness. joint research, as already mentioned by our chair also. We can learn so much from each other. Availability of medicines. You have on the human field essential medicines. We have the same on the veterinary field, and they are not only essential for animals, but also to prevent zoonotic diseases and ensure food safety and the feed supply, and to ensure sustainable healthcare workforces. So thank you very much, and I see that it's exactly 6 minutes. Thank you.
Perfect. Thank you, Nancy, for your presentation. Now we are going to ask to Diana Texera from the Animal Health Europe to present, the manufacturer perspective on preparedness, surveillance, and One Health policy. Just to mention that you are the voice of the European animal medicine industry, and you are the manufacturers. And you encourage a constructive dialogue with governments, public policy makers, legislators, and regulators, non-governmental organizations, the veterinary profession, the food chain, consumers, and other stakeholders. So, Diane, please, for 5 minutes or 6 minutes.
Thank you for the warm welcome and for the invitation. I will try to be as disciplined as Nancy was. So I totally agree, and this could haven't ended with a better introduction to my presentation. I totally agree with Nancy when she says that One Health is not only IMR, but also it's not only foodborne diseases and pandemics. One Health for us is coordination, is communication, and it's also collaboration. So that's why we're very, very happy to speak about collaboration on this webinar. And the images that you are seeing here are from awareness campaign that we are doing not only with the MEPs, but also with the European Commission and the Council to show how One Health is important and how One Health can be very, very broad. So for preparing for that campaign, we prepared we prepared two different documents, one position paper, and then another that was more on the focus areas. And on this document, we try to focus on three things: actions for short term, and then also actions for medium and long term. On the actions for the medium and long term, we identified 10. So we realized that we couldn't keep saying we cannot only speak about IMR, we cannot only speak about foodborne disease, we cannot only speak about pandemics, and not have an answer for what should be speaking then. So we think that we should be speaking about first intersectoral collaboration, and then also territorial cooperation and harmonization, because One Health is not one topic that is national, it's an international topic. It's also not only EU level, and it's not only about veterinary medicine, it's about all the professions that are involved. Then we feel that we never explore the human-animal bonds. So that's one of the things that we really think that people need to understand that impacts human health on a positive sense, of course. Then also the research gaps that we have in both human and animal health, and how can we actually work together to have research and development efforts that make sense through, for example, comparative medicine, and it uptakes research in a better way. Then also leveraging synergies in terms of, for example, supply chains. And of course, raising public awareness, working in literacy. Nancy already spoke a lot about this. And we cannot forget that we use animals also for food. So we need to ensure food safety, but also sustainability on the food production systems. And for that, also the topic of responsible use of medicines always comes up, of course. And then all the work that we need to do on preparedness, surveillance, early warning. you know all about it because we are all speaking about this in every level. So basically the key message, I would say, it's really that teaming up is the key. And I was very happy to see the panel of this webinar, specifically because I feel we are working with everyone, or at least we are sharing goals. So with the Association for Health Management, we are in their the group, the Siege on One Health, special interests group. And we work in a lot of very interesting initiatives, but you will learn a little bit more later about it. Then we work also a lot with FV, especially on Pet Power Alliance and on EPRUMA, that is the platform of responsible use of medicines. And then we also align very much with what was said by Sabea and the chief group of scientific advisors. I just put here our little table with the objectives and the practical actions for short term and long and medium term that align with their papers. And I think it's quite visual that there is a lot in common. Then, of course, we don't only do intersectoral collaboration, we also do sectoral collaboration inside of the profession, inside of animal health and welfare, of course. So this is just to show in how many collaborations is Animal Health Europe involved. And most importantly, I think that is to think what we need to do to take it to the next level, because it's amazing to speak about what is being done already. But we really would like to apply a 3 R's approach from now on. And the 3 R's are totally not the ones that you are thinking about. I'm not speaking about 3 R's in science or animal testing, but one would be regular dialogue. The second one would be rapid and early decisions. And the third one would be risk sharing for efficient use of resources. So we can finally pass from this firefighting approach to fire prevention approach. And how can we do that? We would say in short term, we can make very, very specific actions to get there. One of them is to create an advisory group that would work only to map the associations that are working on certain initiatives, what are the initiatives that are ongoing, and how can the institutions help in that initiatives and take the best out of the collaboration. Then a little bit more of an operational platform, and here we would really go into preparedness and response. And there it's really like the importance, it's to focus the importance of the dialogue between industry and institutions, and also users of medicines, because we need to coordinate between all to know what to do and when to do. And it's really complicated, but I think we'll have more time in the debate to discuss that. And then, of course, ensure coherence in all policies and all financing. And when it's already difficult to ensure coherence in all policies that involve animal health, then if we have to ensure coherence in all policies that involve animal health, plant health, and human health, it becomes even more difficult. But last and not the least, a very, very short-term action that I proposed is that everyone joins our conference that is about preventing disease X. And I think it's a very good example of a networking opportunity to leverage this operational platform that we are proposing. So basically our message in general, it's that prevention is better than the cure and preparedness is better than cooling in animal health. And this can, of course, contribute to breaking the disease cycles in animal health, but also in human health. So if we stop it at our level, and people don't need to really suffer. So, well, that's it. Thank you so much.
Okay, thank you, Diane, for your presentation. And Now we are going to, to jump to the third one. Maria Jeftik is representing the European Health Management Association in Europe. And this European Health Management Association is working, has been created in 1982, and it focused its actions on health management capacity and capabilities. So Maria, please, for 6 minutes. Thank you.
Thank you very much. I'm happy for being here, and I will be today representative not only of EMA, Scientific Advisory Committee, but also as associate member of Academy of Medical Sciences of the Serbian Medical Society, who is the member of Federation of Academy of Medical Sciences. As you know, EMA is a non-profit membership organization, and we decided, launched in 2023, special interest group on One Health, to advocating for health management to transcend the traditional boundaries between disciplines and sectors. And we produced one paper, some position paper as a pathway to improving sustainability, optimizing resource use, and unifying approaches within global healthcare system inspired by One Health. The One Health approach recognizes the interconnectedness of human, animal, and environmental health, but its management aspects remain underdeveloped. So we decided to enhancing coordination, resource allocation, and policy making across the sectors. So One Health Management is a comprehensive and strategic approach that integrates leadership and coordination across human, animal, and environmental health sectors. And of course, this approach is grounded in the principles of effective governance, co-design, co-production, ensuring a holistic and coordinated response to health threats that impacts both individuals and communities. One Health Management coordinates resources across sectors to ensure more equitable distribution and long-term planning and investment in cross-sector infrastructure. That is our basic principle. One Health Management under the policy making influences the development of new governance structures that facilitate better cooperation between ministries of health, agriculture, and the environment. And in the field of research, One Health Management encourages interdisciplinary studies that could lead to more comprehensive and actionable data for more effective interventions. In practice, we developed produced development of integrated community-based health initiatives that consider the full spectrum of factors affecting health, foster cross-sectoral collaboration and preventive measures, that is very important, that can significantly enhance hospital management by adopting green management practices and working closely with public health authorities, veterinary services, environmental agencies, and the private sector, of course, having in mind private and public healthcare facilities. Also, we are supporting the green skills through the One Health Management approach and implement educational programs that foster collaboration and emphasize interdisciplinary training, develop curricula aimed at reskilling and upskilling diverse professionals, focusing on green skills, digital competencies, and pandemic preparedness. So One Health Management, it's not only antimicrobial resistance or veterinary skills or preventing or medicine, but integrated approach. And we can mention some important challenges persistent institutional silos between human, animal, and environmental health sectors, and we should work on it, and sustaining a long-term level of collaboration between diverse factors, and also how we can work on a resource allocation. And implementing One Health management involves sustainable investments in infrastructure and training, and also work on cultural and institutional resistance to shifting long-standing priorities that will require significant advocacy, education, and policy reforms in One Health. Also, we organize online policy debate to discuss current policies in addressing One Health challenges. And also, I would like to mention Symposium One Health Day, organized by Academy of Medical Science, and we also established collaboration with the European Health Management Association, and also with FEAM, organized different speakers from the field of interdisciplinary topics and point of view regarding One Health. And for the end, I would like just to open a discussion. Thank you very much.
Okay, thank you very much, Maria, for your presentation. Now we are going to ask Tuomo Evelo to present his presentation. It's a fourth speaker. Tuomo Evelo is a member of the SAPEA working group. This group has been working on the draft of evaluation review report, and I would say the deal was to contribute to define in a better way future governance of One Health in Europe. And I am happy to show you this document. It's I would say the scientific opinion drafted by the GCSA based on the report of Thomas. And Thomas was a member of the group, and the group was led by Jakob Zinstag. So Thomas, up to you. Thank you very much.
Thank you very much for the introduction, and I'm happy to be here to talk about the work of our expert group. I'm going to shortly tell you about kind of like my background, my kind of like practice-oriented view on One Health, and then a few words about the findings of evidence review. I'm currently assistant professor in biodiversity and society in Leiden University in the Netherlands, and academic research fellow in disease ecology in the University of Helsinki in Finland. My own approach to One Health, this is something that I've done and doodled and played around when we consider kind of like One Health and rats, urban rats that I have been working mostly recently. I like to use this slide not because it's useful tool as such as looking at all the things, but it's useful in seeing how many different things come up there. When we just consider one species like urban rats, and how people and other species ecosystem works with these species. There's anything kind of like how humans affect the rats, how do rats affect the humans, how do the ecosystems play there. And I like to kind of like, so One Health, if it means that to really focus on One Health and make sure that the urban environment is as healthy as possible for humans, that also kind of like calls for us thinking, how does the urban environment become as healthy as possible also, for example, for the rats. And we are truly kind of like, so we are a interdisciplinary, transdisciplinary group of researchers who work on rats, not only ecologists, not only epidemiologists and microbiologists, but we have people from cultural history, environmental policy research, social work, psychology, educational science, artists, architects. If you want to see the website of our research group, there's a QR code also there in the corner of the slide. So this is kind of like, and we also obviously work with a lot of stakeholders. We have a stakeholder group of 150 persons currently. So anybody from pest management and environmental health to animal welfare, property owners, property maintenance, and so on, which we bring together kind of like yearly to discuss issues related to how do humans and rats survive together and other species survive together in urban areas. But also kind of like the role for which I'm asked to be here is that I was part of the SAPEA evidence review report that was led by Tyra Krause and Jakob Simstag. And our results were published in the end of last year. Again, QR code for that report if you want to find that. So there are 3 different documents playing around in background there. The scoping paper from the European Commission, which asks kind of like which kind of like advice they want from us to get. I was part of the evidence review report, where we look at the actual scientific evidence for different types of how does One Health governance works in EU and broader. And then there was the group of scientific chief scientific advisors who then gave a scientific advice based on our evidence review. I was in charge of the one of the chapters for the, and I'm going to just say a few points that raised from our report. We were looking at the leverage points for building capacities, planning and implementing One Health policies. And we did 2 things there in the chapter. We did a literature search on the benefit cost ratios of One Health initiatives. And then we look at the specific case studies where One Health has been implemented. The literature search was kind of like, it kind of like affirmed what we were thinking already. So One Health literature is very much focused on infectious diseases, and it is very anthropocentric in focus. Specifically, kind of like a lot of the kind of like, so when we measure the benefits of One Health initiatives, the most common way of looking at the benefits is looking at the economic values of human health or human lives. So looking at disability adjusted life expectancy or such measures. So it is kind of like there is a room for the diversification of these benefits of the One Health initiatives that needs to really be done. Then specifically on the 6 case studies, they were from very different timelines of how far away these cases are. For example, trichinosis control in Europe has been started in 1860s already, and it has been working for a long time to get really holistic approach on trichinosis. Whereas some of those cases are much more recent, like One Health in cities, which already starts to kind of like combine also these biodiversity related aspects, social justice, governance, and also other measures than just kind of like infected and the health outcomes of infections. Really interesting to look at these cases because they tell a lot of like where One Health is, where it is, what are the best practices in certain areas, and where a lot of work still needs to be done to go forward. As a recap, well, there's still the links and the QR codes for those to our RED project website and the evidence, expert evidence review for SAPEA. Thank you.
Okay, thank you, Timo. Now we are going to start, the second part of this webinar is a moderate panel discussion. I'm going to ask to the panels some questions and to discuss with them. And the audience is also invited to to ask questions through the chat, and there is some question. So please continue, and we will, fuel the discussion with your questions. So I will start with Nancy De Bruyn, because she was the first speaker. Just to remember that she is working at the Federation of Veterinarians of Europe. So Nancy, you have outlined a strong case for integrated risk-based preparedness. In your experience, how does these visions translate into daily veterinary practice, especially in terms of collaboration with human health professionals? That I think it's a very, very strong deal for the professionals. Please.
Yeah, thank you very much. Indeed, it's always a challenge to translate these more principles into the daily practice. And I was a practitioner myself, and I must say that I didn't think a lot about One Health when I was doing that. But in the meantime, I think almost, a lot of things veterinarians and human doctors are doing is in the One Health, as in the One Health fields, while they maybe not directly realize it. And let me give 3 examples. The first one is, of course, on zoonotic diseases. So when you have a pregnant lady coming to a doctor and she tells that she has a cat, of course, the first thing both the doctor and the veterinarian will think about is toxoplasma. And there to give advice how to prevent toxoplasma infection. And this is both something that doctors do, veterinarians do, and where we can work together better on what is the best advice to give. The same applies for Lyme disease or Bartonella or ringworm or scabies. All of them, if you see them either in the animal or in the patient, it is necessary to think about the other animal, the human or the animal, and also about the environmental aspect. So while this is a very obvious one, I think another one is the possibility we have as healthcare professionals to talk about certain One Health issues with our patients and the owners of the animals. And this, of course, regarding antimicrobial resistance, but also on the appropriate disposal of medicines left over, or on raising awareness on the benefits of vaccination. And then a third example, the last one, and I'm really happy it was already mentioned by 2 other people, is the human-animal bond. Because for many people, an animal is more than just a pet. It is a lifeline. So people that are struggling with loneliness, with depression, and so on, the animal is the reason they get out of their bed in the morning. And then it's really important, both for the doctor and the veterinarian, to work together to keep the patient, who often are immunocompromised patients, and the pets healthy and together to have this beneficial relationship. So while we don't think it so much, we actually, both of the healthcare professionals, we do a lot of One Health work, but maybe we don't reflect on it enough.
Okay, so lots of progress to do, lots of effort, so please continue. I will ask a question now to the second speaker, to Diane. So please, Diane, how do manufacturers perceive their role in the future European One Health strategy, especially considering the most recent animal disease outbreaks and the impact it can have in human health? Please, Diane. Sorry, please. Yeah,
Thank
Diane.
you for the question. As someone said once, I think it's if you want to change the world, you actually need to start by changing your world. And that's the thing that our members are trying to do in the animal health sector. So, of course, whether it becomes a formal One Health strategy or it's just an informal strategy, we need to get involved and to contribute to the recognition of the role that animals play in disease transmission and also in pandemics. But not only, also on how can we prevent that. So we all know and we all heard about all the pathogens of concern spreading, and of course more science-based health solutions and veterinary expertise in the field are part of the solutions that are needed in an integrated way. And our members specifically are contributing, of course, with research and development because we are representing innovatives, also generics, but going for the innovative parts. Then the vaccine production and distribution is a huge part. Then partnering with governments and maintaining vaccine banks for diseases like blue tongue, for example, that we just had this outbreak that it's not necessarily an example of One Health, but it's an example of coordination and the need for more dialogue and preparedness. Then enhancing supply chain resilience is something that we are trying to work on also. Public awareness campaigns, you already saw the pictures before. Then also making sure we contribute to the supply of safe and high quality products, not only our veterinary medicinal products, but also food products. And supporting during emergencies, that's what we try to do. And we are coordinating between our members also. And of course, all the policy and advocacy engagement that is needed to contribute with all of this. Because of course, our members are solution providers and we need to create tools to actually do something and progress somewhere, right? So of course, there are things that we don't think about, but by using animal health, as I was saying in the beginning, to do its part, you are also contributing to the other parts. So, for example, the FMD outbreaks, as it was a very recent thing. Did you know that actually by controlling FMD in beef cattle, we can reduce 9.1% of emissions? That's environment. And then, for example, did you ever think now on the negative side, because Nancy already covered the positive side of human-animal bond, but did you ever think of the negative side of human-animal bond? And how do farmers deal with animal culling? Like the animals that they dedicate their lives for that are dying because there is a disease outbreak that we didn't prevent. So these are considerations that you need to think again on the animal health contribution to human health. So we try also to empower farmers on this perspective with education and favorable conditions to technology adoption. But of course, we also try to go out of our silos, as I mentioned before, and we try to go to put a One Health approach in our invaders. And we're members of PRESOD, for example, that is looking at future pandemics and how to prevent them, or projects like William and ID that is looking at understanding climate change impacts on pandemics and epidemics and how to prevent it. But of course, there are things that we could coordinate better. For example, when we're speaking about supply chains, we need to understand that both medicinal products and veterinary medicinal products share a lot of resources, and we need to always make sure that we don't have unintended consequences in one or the other, because otherwise, if you are risking animal health, for example, you are risking public health, and it's really you cannot go from a point of stigmatization or lack of prioritization of animal medicines, because in the end of the day, it's all connected. So I think I'll stop here because I already.
Okay, thank you, Diana, for your, I would say, answer. And now I'm going to ask to Maria, I would say, a question. So you have worked extensively on health system and intersectoral management. Maria, how can occupational health managers more actively integrate One Health thinking into institutional practice, please?
Thank you for your question. Occupational health managers are the similar education like specialists in hygiene or public health. And to integrate One Health thinking into institutional practice, it means to think about how we can solve the resistance, how we can improve education, and promote cross-sectoral collaboration and foster partnership between human, animal, and environmental health sectors. It's also very important to underline environmental issues, and ensuring that environmental and occupational health are aligned with the broader public health goals. Also, we should encourage data sharing and monitoring in line with open science, and create systems to share information across sectors. So it means improving communication across sectors in the aim of early detection, improving and response to health threats. Also, we need to build capacity and awareness. So we have to train health professionals on the One Health approach, emphasizing the interconnectedness, animal health and environmental health together, not only in a separate faculties, veterinarian and medicine, and advocate for preventing all preventing measures, not waiting some accident or epidemic, but working on preventive measures. And by fostering a holistic approach, health managers can enhance institutional practice and improve overall health outcomes, I think. Thank you.
Okay. Thank you, Maria. So now I ask Tuomo. I have a question for you, Tuomo. Given your experience with the SEPIA evidence review report, how can we ensure One Health become a real priority in the FP10 framework program, European Research Program, and future EU research programs in general? Please.
Obviously, we have well-defined gaps now in research that we really need to push forward on figuring out how to fill those research gaps. Like I mentioned, it's very zoonosis and AMR oriented so far, the One Health, and also looks at very much on the human health and very much on the economical side of the human. So in that sense, we have a good idea of what needs to be done. Then again, there's a question of there's a word I both like and dislike, which is polycrisis. So we're living in the time where we talk about different crises of environmental crisis and social crisis linked to biodiversity loss, climate change, and so on. So I think, obviously, the good thing that the health has going on here is that it's highly valued, especially human health is highly valued. So kind of like linking that to these kind of like larger changes in environment, whether it's a habitat destruction and the furthering biodiversity loss, or kind of like whether it's a climate change and all the related heating, flooding, extreme weather events, whether it is there, it is important. Obviously, the silos are there, and we need a lot of work to kind of like for example, for the those institutions that are responsible of the wildlife population to also consider diseases and health of those individuals in those populations. But we also kind of like also on human health side, we do need that kind of like ideas of how wildlife and other animals are very important. Coronavirus and avian influenza and mpox have all shown this. So kind of like I think it's kind of like both kind of like the political we need a political understanding that human health is highly dependent on the ecosystems, environments, and other species, and then we really need to push those kind of like as kind of like actionable research topics, that these gaps that we have now found to do those working progress.
Okay, Thomas, thank you very much. Now we have time, you know, to open discussion with the audience, and we have some question in the chat. It has been raised probably in the direction of Thomas. Reference to entomology, the place of the entomology in the One Health approach. You mentioned the West Nile, and we have also the experience of the virus with the blue tongue virus. Very, I would say, severe outbreaks on cattle, and that raised the question of the place of the vector-borne disease, and in general, the zoonotic vector-borne disease. So, Timo, could you, I would say, give us more information on the place of this entomology discipline in the One Health approach? Because some experience now are running well. We have experience in France in collaboration with Spain, you know, on vector-borne disease. So could you, I would say, give us your light on this point? Thank you.
Thanks. As Anders the question in the chat, it is like medical entomology is a little bit like dying art, and that goes kind of like that is true for a lot of biodiversity kind of like taxonomists of olden ages, when natural history museums and other institutions were full of people who were interested in systematics and taxonomy. There are kind of like there are less of those, less who are able to do the kind of like identification of the species, finding new species, and classification of the species. Then there's also the obvious problem is that there's a lot of species in the world, and none so more than insects and other arthropods. Ticks mentioned here, mosquitoes, and so on. So there are obviously the kind of like the modern technologies of barcoding, meta-barcoding, and this kind of like environmental DNA approaches, which are kind of like more and more used to understand, for example, mosquitoes, where do they reside, which pathogens the mosquitoes are carrying. So I'm not sure whether there's ever return of kind of like to that position where systematics and had such a high position within the life sciences. But I do think these modern methods can provide much higher scale, high throughput identification of the biodiversity, either the one vectoring pathogens or something else. But I do kind of like I do think that that those people who are good at the systematic side of things, they are very valuable in future.
Okay, thank you very much for Timo. Another question, maybe for Nancy. It's a problem of communication. In fact, all our, I would say, effort, exercise, you know, in terms of integration, I would say interaction between the different levels, the different bodies, the different entities, the different governments. The problem is the communication with the public. and the large public, or the, I would say, maybe also the professionals. But could you, Nancy, give us your opinion on this challenge? Because that probably will be a key issue for the future and for the success of this One Health approach.
Yeah, absolutely. I think this is a key issue, and we have, especially on health information, a lot of what I would say fake news going around. So there, I think our organizations really have a crucial role to bring out reliable information on like vaccination or certain treatments, that you see in the internet. You now already see that certain doctors step up in TikTok videos and things like that to try to challenge that. But maybe there we should together do more. And we do it, we have this information, but I think the problem is we don't always bring it in an easy to understand format to the public. So just simple infographics or more simple small videos on what is the correct information, like on disposal of medicines, on the use of antibiotics, on certain zoonotic diseases. All these things, I think it would be really beneficial, and it is a task for all of us together.
Okay, thank you, Nancy. Maybe we have enough time for the last question. I selected from the chat another question related to training, and maybe Maria could contribute to highlight a position. When you're talking about training with your experience, you are facing several professionals. And how could we improve the training for such variety and heterogeneity of professional profiles, please?
Yes, thank you for the question. I think that it's training, it's very important, and education, but not a separate training, but common training. And we are trying to connect different disciplines through some symposium training conferences. That is the part of lifelong learning training in Academy of Medical Sciences. In EMA conference, we will organize, for example, this year, One Health Corner at the conference, and we will engage and invite different disciplines to discuss together. Also in European Health Public Health Association, during last years, we organized different kind of workshops, interdisciplinary workshops, but I think that it's more important to organize interdisciplinary master and PhD studies at universities to prepare different kind of experts like medical doctor and veterinarian, environmentalist, to work together and communicate together and prepare for prevent resilience in organization tomorrow.
Okay. Maria, thank you very much for your, I would say, answer. We are on time. We have just 1 minute for the closing notes. We have been happy to exchange today. It's the first webinar of probably expected, future webinars on One Health organized by FIRM. I invite you to continue your interpersonal discussion after the webinar, because we have a set of questions, in the chat, but we have no time to answer to all of them. Where we identified, the key points of consensus. We are convinced that the veterinarians, the hospitals, the medical, and so on are public goods, and we have some challenges. Gaps and barriers are still present to implement the One Health. And we have also, opportunities for the future to influence, the drafting of the priority for the future framework program in Europe, improving also the local level cooperation, and I would say enhancing the role of professional networks. At this step, I have to close this webinar, and I thank the panelists for their insights. I remember attendees that a summary report will be circulated and will be, I would say, present on YouTube. Thank to all attendees, the speakers, Louise Haboud and Anna MacDonald for the preparation of the webinar. And it's time for me to thank all of you for this webinar. It's time to close this webinar. Thank you very much. Bye.
Thank you, Andre. Thank you, Juan.
Thank you. Bye.
Bye-bye.
Have a nice day. Bye-bye.